Thank you, Dr. Ramaiah, for getting me in. Actually, I'm going to change the topic because I was supposed to give the hemo wrap in the morning. That got misplaced. I don't know which one is there. Is this the one we have now? Hemostatic? Yeah, this is the hemostatic device. Actually, there was a talk at 11 o'clock, so it got misplaced. So they asked me to give the talk now. So this is the background
Great.
is, yeah, sorry.
Have at it.
Yeah. Okay, we know that these days with the vascular, peripheral vascular disease and for the coronary disease, we are doing mostly radial and tibial access. Actually, it's getting to be in the mainstay doing this approach. And that's because there's a better morbidity from not getting bleeding from the femoral artery, and the patient gets better faster and go home sooner. But I did not know that there was about 27 different companies making these devices for the radial artery hemostasis. Most of these devices have plastic band or plastic, and then also some of them are screwed in. The mechanism of action is they compress the artery, and then they let the artery open up a little bit more to get the flow hemostasis. So problem is, it is a little bit cumbersome. It takes time. It takes a little bit of training to be done. So we came up with a newer technique. It's called a HemoWrap. This is actually a soft, palleable, and what it is it gives a localized compression like what we do with the fingers. Basically, when we have a puncture of the artery, what we do, put the finger and close it. So with this technique, what we have done is using the sponge and putting this compression bandage and inflating it just to get localized compression so that it doesn't bleed. The beauty about this is it comes in different sizes. So you can go, as you can see, from small one to 45 centimeter in diameter. So this has been used in places like post-hemodialysis and after vascular intervention for the AV access, and also for the tibial and for the radial approach for the coronary disease. And we did the compression measurement on this. As you can see, we put the pico pressure underneath this bandages, and the pressure we use only 42 to 60 maximum of the millimeters of mercury, which means it's below the mean pressure of the artery, and so it keeps the flow going without compressing the artery. Here is the thing. This is in the radial. This is a 6 French pedicle sheath, as you can see. All that we're doing is putting the wrap around it, putting the pump, just one squeeze basically, and then it inflates the balloon, the bladder. It's got a big window, and then you just pull the sheath out. Basically, that gives the hemostasis. And then remove the inflation device, go to the recovery room, and this is for the venous, for the AV access, for the hemodialysis patients, typically the same thing. After the decannulation is done, and this is for the AV grafts in the upper arm after the patient had interventional for the stenosis. So it can be used in the graft on the fistula or in the radial artery. Basically, just one pump, you get the compression there, and it's local compression. Basically, it's only 40 to 50 millimeters of mercury, and this is in the tibial vessels too. So. And now we can see there's a flow of the vessels, even with the thing inflated. So then after that, after 10, 12 minutes, deflate the system. All that you have to do is put the hand pump in there, and then just deflate it. There's no bleeding. Just after about 30 seconds, if there's no bleeding, just remove the wrap. So it was done. There was a safety, Emory University, they did a patient for the hemodialysis with the 2 needles, and they did about 28 patients with 166 times. And there was no complications. The average patient satisfaction was 4.6 out of 5. And this another one was done with Azura Vascular. This is for the AV access. About 40% were fistulas and some were grafts, and the size, the right and the left were the same. And the fistulogram was done, some numbers, angioplasty and thrombectomy was done, and the sheath size varied from 4 to 8 French. And the whole time ranged anywhere between 15 to 35 to 40 minutes, depending on the anticoagulation status. And that there was no complications encountered. Similarly, so the study conclusion was an Azura vascular access, 30 patients studied showed functional as expected with minimal postoperative bleeding and complications. And with Emory Healthcare, this novel device was safe, effective in achieving the post-cannulation hemostasis, and was preferred to manual compression by the patient and at our center. So we did tibial access. 200 patients have been done in the last 9 months. Sunrise Vascular, and we did at the Westchester Vascular between us, 200 patients, and we had no thrombosis, no hematoma, or no suturing was included. So in conclusion, it is safe, cost-effective, and time-saving. It has been shown to be like excellent patient satisfaction, and it can be done with minimal training. Actually, all that you need is pump it one time, take him to the recovery room, wait for 20 minutes or 30 minutes, deflate it, and then just remove it. Thank you so much.
I have a question for you. Are they one-time use only?
Yeah, this is one-time disposable.
How much do they cost?
$20.
20? Okay. So thank you for bringing us something